Hello, everyone, and welcome to this special session for Worth a Shot. Our effort is to introduce you to distinguished minds of medicine and science and community leaders who inspire us. So Worth a Shot is very proud to partner with UDH Health Coach to elevate public health in Haiti. And we have two esteemed guests today, and I'm honored to host them. We are very honored to have Mr. Alex Simeon, who is the founder and executive director of UDH Health Coach. UDH Health Coach is a nonprofit organization that assists the Haitian community in health awareness and self-care. The program also educates and raises public health awareness regarding primary care and empowers patients to become better advocates for their health. We're also very honored to have Dr. Marie-Louise Jean-Baptiste. Dr. Jean-Baptiste is the Director of Minority Affairs, the Medical Director of Healthcare for the Homeless, a part of the Cambridge Health Alliance, and an assistant professor at Harvard Medical School. Dr. Jean-Baptiste is also part of the UDH team and actively supervises teaching of medical students in Haiti. So thank you so much, both of you, for joining us today.
Thank you to have us. Thank you.
Thank you, Mayor, and it's a pleasure to be with you today.
So, Mr. Simeon, for our audience, please tell us a little bit about the story behind UDH, and please also walk us through what efforts UDH does in the community.
As you know, and I understand that you would like to share with your audience what we are doing exactly with UDH Health Coach. UDH Health Coach, as you said, it is a nonprofit organization. Where we are coming from, it's just after the earthquake in Haiti in 2010, we decide as a community to give to Haiti or to assist Haiti to rebuild his personnel, because as you know, we lost a lot of professionals, like on healthcare part, on education, wherever we lost. It's like everybody. We said to rebuild the community, and then as we have a lot of friends around here in Massachusetts, we decide to collaborate with the University of Notre Dame to have a student come over here and have education, a way to rebuild the country. And then, as you know, in the world, without education, no one go anywhere. That's the reason. And then I met a lot of friends. And then since, as you know, Dr. Jean-Baptiste, part of CHA and Harvard University, and offer her commitment to serve those guys and to make them up to date.
Thank you so much for sharing that story, Mr. Simeon. That's such an inspiring story.
Thank you.
Dr. Jean-Baptiste, please tell us a little bit about yourself, your role at Harvard Health, and the motivation behind starting UDH.
You said MBH?
So please just tell us a little bit about yourself, your role at Harvard Health, and also what was your motivation behind starting UDH?
Oh, UDH, okay.
Yes.
So I have been practicing medicine. Well, let's start by saying that I was born, raised, and went to medical school in Haiti. And the reason I moved here was to further my education. My primary goal was to go back to Haiti and practice and help the country. However, with so much turmoil and because of health reasons in my own family, I decided to stay here. And given that so that's one volet. The second is I train at Cambridge Health Alliance, which is a community or hospital who deliver primary care and public health to a very vulnerable population, including immigrant, homeless, and so on. So it's a very inclusive place. So I train at CHA as a primary care. And after my primary care, I stayed on staff and started working with the Haitian population. So in a way, it was satisfying for me because I felt that what I would have been doing in Haiti, I was doing it here. But working with the patient one-to-one, I found was not fulfilling my goal because a lot of people need education and it was hard to do it one-to-one. So very early, I get engaged in community advocacy. And from there, we started to have a diabetic group. And in 2003, and the goal was to do peer-to-peer education with people affected by diabetes. And as we were working with universities, especially Harvard University, I had a student working with me. So instead of just doing the group, we started to like an academic mission for the group. And that's the student was working with me, did a video on the diabetic group, along with other colleagues such as Dr. Arlene Katz. And from there, we keep evaluating the group and asking patients about what will be best for them. And then they say that, well, we learn a lot, but we like other people to be able to be getting that information as well. And the suggestion was to do other group. And so we did. And then came the radio. I used to do radio a long time ago, but I stopped doing it with Mr. Simeon, who came with the idea in 2012, since we were serving the community, to start doing the outreach in the radio. And as we were embarking, working with University Notre Dame in Haiti. So that's how the radio started. And the rest is history. The students started coming. And first, you can say that, Alex.
First, what we did is when the students come over and then they ask to assist Dr. Jean-Baptiste.
No, but you should talk about the United Nations.
Oh, the United. United Nations, as I said, after the earthquake, invited Haiti to be part of that organization, because as you know, United Nations has more than 60 years, but it's only after the earthquake
for the student.
It was a
program for students.
Yes, exactly. It is after the earthquake.
You know about this program, don't you?
They call it HN Moon.
HN Moon. It's a program for college students to come and pretend they are diplomat and they are working on project. And for this first time after the earthquake, the University Notre Dame was invited to participate in that seminar, which is about 4 or 5 days. And we were the one helping the student to get there, and also with hosting them and then getting them connected in the community. And we did that multiple years. And one of this, I think the second year, one of the students, because they had medical students, they have students in different areas coming in to visit. And one of the students came to me and she said, I would like, because they offered outside rotation, the University of Haiti offered an outside rotation to the student. And because she had family around here in the US, she said, instead of going in Europe, I want to go spend the time with you guys. So that's we started, but before she came in, we had to have new
MOU.
MOU with the University Notre Dame and Cambridge Hospital. And that student came and spent a month. And then that gave us the idea, well, maybe we can do it with more students. Maybe we can have a combined project. And that's, we started to have nursing and medical students come in and visit every single year. They would spend a month at Cambridge observing in their different fields. And then the idea is for them to go back to Haiti and to teach others. So that stopped after COVID. During the pandemic, it was hard to invite anybody. As you know, there was a lockdown. And then since we are not able to do that, we say, why don't we do a project online to look at COVID in Haiti and COVID here? Because as you know, COVID affected people of color more than anybody else. And there has been a lot of resistance toward looking early treatment for COVID and also vaccination. So that's when you started working with us. So we decided, well, let's do a project online and let's try to figure out what is the mind on the people so we can know to do targeted education. So that's why we started the project in line. And with the project in line, then we say, why don't we also do a medical project, like a accompaniment project? And that's why we started this program right now.
That's really amazing, Dr. Jean-Baptiste. So, Mr. Simeone, I know that you talked about this a little bit earlier, but please tell us a bit more in depth about the role of UDH in helping medical students in Haiti.
Yes, UDH, as I said, it's like a little private organization, non-profit organization. Why I said that? And it's because when we started with us. I mean, as a family thing. Sometimes we call a few other friends. Other than that, as Dr. Jean-Baptiste said, because of the collaboration of CHA, and then sometimes we have some support assistance to move forward.
Can I add something?
Yes, please.
So the goal is to make the Haitian student, nurse, psychologist more competitive at the international level. Because, you know, being a small country and having a lot of turmoil, so you don't have all the facility that some students get here, like in working with Harvard and also with staff. Student as a preceptor, and especially with Harvard, the preceptor is invested, and also with the MPH is invested in the student. So the students are not left alone to learn, but they have some guidance. They have guidance to multiple preceptors and to their teacher and to their advisor. But because of the limitation of Haiti, that doesn't happen that way. So the students usually are left on their own to figure out stuff. And so our goal is to like mentor them and also find out where the gap is and to try to help fill the gap. So that's one of the goals, and that's why we are doing multiple things. And what we are doing is an accompaniment program where the students are learning to do presentation skill, but they are also learning about the topic, and they are also learning about team building.
Mm-hmm.
This is exactly my involvement, where to get all those things done, you need a technical guys who can drive things around. Based on my my expertise in IT, And then I personally responsible to lay out a platform with Google Classroom and Zoom, and organize my own network and take care of my my website and everything. This is my specialty to, that my responsibility for these, for those things to move up, because as you know, technology is on everything now today. Without that one, we will not go anywhere. That's my specialty, my responsibility for, but it's not easy. Haiti, for the network, for internet, drive us crazy, but we make it. So far, so good.
Thank you so much, Dr. Jean-Baptiste and Mr. Simeon. This is a wonderful organization with a wonderful mission. So, Dr. Jean-Baptiste, what have been the benefits of working with students in Haiti as well as in the United States, and how does it help both communities?
Well, first, I think the benefit is it's always good to teach, because as you teach, you learn more, because you always have to go find out what the gap is. And before you can even deliver it, you have to make sure that you yourself, you are competent in it. So a personal goal is for me to continue to go. But also, as I told you, Haiti is like suffering from exodus. A lot of the professionals are leaving Haiti to go work in other places because of insecurity. But however, not everybody is leaving Haiti. So the reason we are doing, we're giving an option to the people who are working there to help them think differently. Even though they have limitation in the lab, but it doesn't mean that intellectually you cannot be challenged. And the goal is to make them understand, as they know already, it's a challenge, how to overcome the challenge in face of adversity. So it's not because it's really bad, there are things that you cannot do. So our goal is to do whatever we can to help the people we can.
Thank you, Dr. Jean-Baptiste. So, Mr. Simeon, how do cultural differences impact the delivery of healthcare?
Well, as you know, technology is how I can call that one, is a roof of education. And if for the technology, for the health, even for the social, whatever the discipline, technology is always on the middle of everything. And then based on the evolutions of the technology, and then that's have an impact on every single thing in the life. That's the most important thing, and that's help us to impact not only on the health, but everywhere, social, economics, or whatever. When you are part of the technology. And then because I worked for more than 30 years in technology, and then I think right now I'm kind of a slow down, but I don't want to stay and without anything to do. And then I said, my participation for Haiti to help them grow up. And then I think that's the reason I offer my expertise to impact those guys on health. And then I believe that without health, you cannot do anything in life, because health is health. If you're sick, If you are sick, you cannot go anywhere. If you are sick, you cannot help. That's the reason I think treat yourself, help yourself can impact the society. I don't know if I'm
So,
kind of clear for you.
but what was
You
the
have
question?
something,
What was your question was cultural?
Cultural, how do cultural differences impact the delivery of healthcare?
Okay. So the cultural difference impact it depends, as you know, culture has to do a lot how you perceive an illness. So there's the difference between illness and disease. So illness is the way you perceive your disease. And so, and that has a lot of impact whether or not the person is going to follow your advice. If the advice doesn't fall in their culture, then they are less likely to follow that advice. And you can use technology to try to reach out to different culture. But when you're using that technology, you are going to use their thinking and go to their thinking and try to reach out to them.
Thank you, Dr. Jean-Baptiste and Mr. Simeon. So Dr. Jean-Baptiste, please talk about language barriers and how do language barriers impact access to healthcare information, and how are you trying to bridge that through your radio show?
That's a great question. So language barrier is not a language barrier, it's also literacy. And it's not even literacy how to read, it's literacy in medicine. So there are some Haitians who are really very intellectual, but there are some also who are less. So it depends whether you're lucky to go to school or not, because the literacy level is very low in Haiti compared to other countries. So being illiterate, sometimes you may perceive things differently, not only because of the culture, because of your literacy level. You don't have access to the same material. And you tend to depend on your family, on your neighbor to give you advice. And sometimes you depend less on your healthcare provider because we may not be talking the same language, although we speak the same language, but the same term. So one of the goals of the radio was to make it plain, so people using their own analogy, and when you use their own analogy, they can understand and get a grasp of what you're talking about. Let me give you an example. If you tell somebody your A1C is high, the A1C is a test for the blood sugar over the past 3 months, and it's an average of your blood sugar. But if you tell a patient about your A1C or your albumin in your urine, what are they going to think about? You tell them, they say, yes, doctor. And they go back, they do the same thing again. Because they don't understand what it means. So in order for the patient to understand, you have to go back to their culture and explain to them in their own proper term, what does that mean? Once they understand it, and it's a very hard concept to catch because it's very abstract. So you have to come with concrete example. So when you use those examples, then they say, oh, I understand now why I need to get my blood sugar better, because the A1C is an average of my blood sugar. So I need to make more effort to improve it. And we have done a lot of study on the diabetic group that we are doing, that once people understand what they need to do for their health, they do better because there is more adherence, because they are talking the same language than their provider.
Thank you, Dr. Jean-Baptiste. So, Mr. Simeon, how did the pandemic impact the UDH program, and what were some ways that you adapted in terms of remote learning?
To tell you well, when people said sometimes that the COVID, the pandemic frees up everything, but at the same time, the COVID brought a lot of things for us. And I can give you an example. We used to have, like 2 or 3 students come here in the United States and then hang around of Massachusetts to do things. But with the COVID, we start from 17 now to 26 people online. When we use the online program, the online program allowed us to have more people around. And then that's true, they are not have any hands-on, but at the same time, I think they learn more and the program is more extend
Available.
and more available for them. And then it's like a classroom. It's like a semester, because the way we do things based on those platforms. And then that means I can say the COVID bring a lot of things, a lot of new things to do, not only for my program, but to the world in general. That's too bad. That's the way I can say. But wherever you have a bad thing, and somehow, somewhere, we have a good thing from the COVID.
Yeah. So we had to find a way to deal with COVID, and and to continue the work.
Yes.
And that's unfortunate that we had to go to COVID to have that done. But there are things that happen because you learn about it. And I think the word I have learned about a lot of stuff about this episode of COVID.
Thank you so much. So Dr. Jean-Baptiste, what kind of challenges do you see in terms of social determinants of health that impact healthcare both in Haiti and here in the US?
Social determinant of care. So not everyone has access to the same thing. And you cannot, in healthcare, you cannot address the issue the same way than when you're using a different vulnerable population. What works for the average American doesn't necessarily work for the vulnerable. I'll give you an example. It's just very simple. Not everybody have access to video. So when you do televisit, then only people who are computer savvy can use televisit. The rest you have to talk to them, call them on the phone. So here you have 2.2 measures. And so the question was, say it again, your question.
So what kinds of challenges do you see in terms of these social determinants of health?
The other challenge, so one challenge is the internet, access to education, access to the same material than other people, able to interpret this material, and also time to do the stuff that you need to do for your health. Because if you are working low pay, then you have family you need to support in your country of origin. Then you have to work 2 or 3 jobs. So what happened? Your health suffers. You're stressed and you cannot access the doctor because the time the clinic is open is when you're working. And on top of that, not only you have yourself to worry about, you have your own family, and you have the community of people who depend on you that you need to help out too. So it really makes it very stressful. And that's why we're seeing so much disease. And one of the things I want to go back again, one of the reasons that COVID affected the vulnerable population is because the multiple family will live in the same household. Because of when you are financially challenged, so you share rooms with other people. you share everything with other people. So when there's a pandemic, everybody in the household is affected. However, if you have a big house where everybody is in their own quarter, so you have less chance as a family to get COVID.
Thank you so much. Mr. Simeon, what new programs are you developing for UDH?
Well, right now, and we're thinking about to keep going with the program, extend the program, and then we're planning to have a new group by January, close that one, and then open with a new group. At the same time, we will find a way to continue with the same group, because as we already discussed, these programs need to be continued. The group we have right now, we feel like they need more and more and more. And then we want also, or we would like also to have more people, more students involved, since we open the program to not only on medicine and nursing, we open that one to psychology also. Not only psychology, we are
looking also for pharmacists.
For pharmacists.
Because there is clinical pharmacy in the US, but I don't think clinical pharmacy is something they do in Haiti. But given the paucity of healthcare worker, the pharmacists, as part of a team, can expand the domain, because they can do drug management, like not drug, but medical management. Like somebody has chronic illness like diabetes or HIV, they can see their provider every 3 months, but in the meantime, if they have a problem taking their medicine, the pharmacist is another way that in the US we use to help extend healthcare. So, and that's why we have the whole idea of team, because each discipline need to be able to work with the other discipline so they can know exactly what to expect from each other. And also speak the same language, because we are all in healthcare. So we need to be able to communicate with each other.
That's amazing. Dr. Jean-Baptiste, what is your vision for healthcare equity, and how can partnerships like ours impact global health?
Well, my vision for healthcare equity is that is really equitable. We are talking a lot about it, but it's really taking very hard to do it. I can just give the example of just ourselves, like a small organization. We are really struggling to do what we want to do, because we are a small organization. People don't put trust in us. But if we are a big organization, we don't have a lot of help. So, and because it's a small group of people, then people pay less attention to us. That's again equity. Because the work we are doing is as important like the big group are doing, but the big group get a lot of support, but we don't.
And I'm pretty sure we will not stop it. We will do it little by little.
We do whatever we can.
Whatever we can.
Thank you so much, Dr. Jean-Baptiste and Mr. Simeon. This was such an inspiring message for all the young people listening to this. I'm sure this inspired so many young people to get involved in their community as well as in public health and global health. So thank you so much, both of you.
You're welcome.
Thank
you. Thank you for your time, and thank you for being part of us. We really appreciate your contribution, and that's really, really enriching and I would say inspiring.
Thank you.